Thank you, sir. So my topic is once weekly insulin, who, when, and how. I have added what and why also to that. This is the disclosure, and there are problems with injectable treatment. Basically, the insulin, the injections are associated with less adherence and termination of the treatment, and also the poor glycemic control because patient leave it. Now, the answer is to reduce the number of the pricks or the injection. And for that, we have got once a weekly insulin in place of, say, one shot every day, one shot every week. And we have got two insulins. One is already in the market in some of the countries, that is called Icodec, or it is available by the name of a weekly insulin. It is approved in Canada, Australia, Japan, and EU countries. Another one is from Lilly, and that is called Epcetora Alpha. It is under regulatory review. So I'm going to review all these two insulins, their place in the treatment management of type 1 and type 2 diabetes. Now, first is Icodec. By the changing three amino acid substitution, it is provided with increased molecular stability, reduced enzymatic degradation, and slow receptor mediate clearance. And because of that, once it is injected, it binds to the serum albumin and slowly release. The small amount of insulin is effective enough to produce the glucose uptake and the metabolic changes associated with insulin. Also, less amount of insulin is there with the receptor side, so receptor clearance is also reduced, and thereby it is the half life of this insulin is increased. Slow and continuous release of active Icodec achieves effective glucose lowering throughout the week. This is the graph. The upper one shows the half-life or the insulin concentration throughout the 7 days of the week, as compared to the yellow arrow, which shows the concentration of insulin deglutide, the present day basal insulin, once daily basal insulin. Throughout the week, there is even distribution of total glucose lowering effect of insulin Icodec. The another one is insulin F-Cetora alpha, which is from Lilly. It is still under regulatory review, but it's got the robust evidence behind it. This insulin is basically a modified single chain insulin variant, which is attached to the human immunoglobulin. And this attachment is associated with extension of half life to approximately 17 days. Though it is a single chain insulin, a small amount is there at the site of action, but this small amount is enough to initiate a cascade of intracellular events that promote the glucose uptake and metabolism. Its binding with the insulin receptor is weaker, and because of that, less amount of receptor associated clearance is there, thereby again increasing its half life. Another mechanism of F-Cetora alpha is that there is binding of IgG, F-Cetora alpha with serum albumin, and this whole complex is recycled after producing its effects out of the cell, and again it is used. So because of that, there is a long half life, and you can see after 2 to 3 weeks there is a steady state, and the effect continues. Once you inject once in a week, and the effect continues throughout the week. The basal effect is almost equal to Icodec insulin. Now, the convenience of once weekly injection, it is associated with better adherence, improved health-related quality of life, less overwhelm on the part of the patient, less of clinical inertia. The quality of life satisfaction scores are high. Most of the patient, they want to switch off from once daily insulin to once a week insulin. The reasons are clear. The frequency of injection is reduced, and the efficacy is even better as compared to certain once daily insulin like insulin glargine U100. Also, there is CGM data which shows that the effect of Icodec once weekly is better than insulin glargine U100 once a day. The time TIR is more in once weekly insulin as compared to the once daily insulin. The hypoglycemia incidence is low as compared to once daily insulin, but it is only applicable for type 2 diabetes, not for type 1. More patient come under HbA1c of less than 7% with less of hypoglycemia, and time below range is also comparable. So less of hypoglycemia or equivalent amount of hypoglycemia. This is the compilation of the trials onwards 1 to 5 trial for type 2 diabetes. And with every scenario, the once weekly insulin fares better as compared to once daily insulin for type 2 diabetic patient. But there is a slight change in the story with type 1 diabetes. Onward 6, which compared the efficacy and safety of once weekly subcutaneous insulin Icodec to once daily insulin deglutide. Though the effect was comparable, efficacy was equal, But the statistically significant higher rates of combined clinically significant or severe hypoglycemia was more in once weekly insulin, that is icodec. And because of that, US FDA approval is not given to this insulin in US. These are the compilation of the trials from insulin F-Cetor alpha. They are called the Quint trial. Quint 1, 2, 3, 4 are conducted on type 2 diabetic patient, possibly with all the combination. Once a day insulin, combination of once a day insulin, bolus, basal bolus insulin, multiple oral drugs and insulin. And in almost every sense, this insulin has proved either comparable or superior, both in efficacy as well as hypoglycemia concern. Again, with type 1 diabetes, the Quint 5 trial showed that this insulin is associated with more severe hypoglycemia as compared to once a day insulin. So this is the catch for once weekly insulin, especially for type 1 diabetic patient. So when almost every patient, the question mark is with type 1, who requires insulin can be shifted to from once daily to once a week insulin. Almost all the patient. How to initiate? Usual insulin, once daily insulin is 10 units per day multiplied by 7. So 70 units per week insulin is given. This is the initiation. How to switch from another patient who is taking insulin once a day? So calculate the 7 days dose. For example, 20 units daily basal insulin, 20 multiplied by 7, 140 units, and just 50% of that dose is given on the day one or the first week. So that for this patient, 140 plus 70 units on day one, and thereby you continue 140 units every week. So this is how you switch it. How to titrate? Plus 20 unit or minus 20 unit according to the fasting blood sugar of 80 to 130. Why once weekly insulin? Because all the basal insulin, even in developed world, in Western world, are associated with poor adherence, and there is cessation of insulin treatment even with basal insulin, and because of that, there is loss of diabetes control. And probably by using once weekly insulin, we can avoid this non-adherence and also the clinical issue. So take home is the insulins, once weekly insulin are having similar and or better glycemic efficacy than daily basal insulin in type 1 and type 2 diabetic patient, associated with less of hypoglycemia in type 2 diabetic patient. They could lower the polypharmacy burden, and they also can increase the acceptance of insulin therapy. The future of once weekly insulin preparation appears bright, and the last is not from me but from a state of the art article from biomedicine, that hypotech insulin is a candidate to become the primary basal weekly insulin. And friends, the future is already here. The combined three trial abstract I could get. It is the comparison 52-week open label treat to target trial involved 600 patients with type 2 diabetes inadequately controlled on daily basal insulin, and then once weekly I combination of I and semaglutide was compared with basal bolus regime of insulin glargine U100 and insulin aspart. The result is amazing: decrease of 1.74% HbA1c, weight loss of 3.6 kg, and less of hypoglycemia. So this is the future, and I think probably this combination may become one of the most strongest contender for better compliance, better adherence, and better outcome. Thank you very much.